Hello, folks. I welcome you once again to my YouTube channel. Again, my name is Professor Festus Sadu of the world of viruses. I welcome you again. I hope you have been enjoying my channel, and I hope you have been subscribing. Today, I'm talking to us on measles, on my topics on viruses. Today, I'm looking at measles virus, one of the most contagious human viruses ever known. The viral agent is the measles. Measles virus is the causative agent of measles disease. It's a parameasles virus, very, very contagious. The attack rate is about 15. What do I mean by the attack rate? The attack rate is that an infectious individual can infect between 12 to 18. It's very, very contagious, very highly contagious. It's one single serotype, and yet very, very difficult to eradicate. One single serotype of the virus, and yet very, very difficult to eradicate. Between 300,000, this is why it is a bit difficult to eradicate. Between 300,000 to 500,000 are needed to maintain the virus in population, even with a very good vaccine. The vaccine is the measles vaccine will cover about 95% of those people immunized. But the remaining 5%, that's always, with this period of years, there's always an accumulation of those 5% that keep the virus in circulation. Please to know this. I want you to see the picture on the right. That is the structure of the virus. There are two major envelope proteins. The H-myoglobin, which I told us earlier when we were talking about influenza, and the fusion protein. Those are the two viruses. Those are the two appendages. Those are the two antigenic appendages at the surface of the vaccine. It uses the hemoglobin to attach to recognize the receptor in the human cell. And uses the fusion protein to fuse both infected and non-infected cells all together. That is why we have in measles what we know as the multinucleated giant cell. I'll be talking to us about that as we go on. The disease description is typically a childhood infection. Please know this. Measles is typically a childhood infection spread by the respiratory route, characterized by a latent period of 10 to 14 days. What do I mean? An incubation period. That's an incubation period of about 10 to 14 days. After that, 2 to 3 day prodromal period, which is characterized by fever, coryza, cough, and conjunctivitis. That is why we always refer to this as the 3 C's. 3 C's. It's only in measles you get this. It's very, very pathognomonic. You have coryza, cough, and conjunctivitis. That's why we refer to it as the 3 C's. This is followed by the appearance of a characteristic maculopapular rash and Koplik spot. That is what is represented in the picture on the right. Don't forget that's only one serotype. And yet even WHO is not even talking of eradication. They are talking of elimination. Why? Because it's so contagious. And the attack rate is very, very high. The attack rate is transmitted through respiratory droplets, coughing and sneezing. There's a period of maximum contagiousness. The period of maximum contagiousness is about 2 to 3 days before the rash. Know this, please. Even before the rash, when you are not even suspecting measles, it's already been transmitted. 2 to 3 days before the rash. At that time, even it can be by personal contact. You can see the picture here through coughing, somebody has infected the other, spread of measles by breathing, talking, coughing, and even sneezing. You can see all those things there. What are the risk factors? Please, let's know this. They are especially for those in charge of controlling diseases, those epidemiologists in charge of controlling diseases, headmaster, kindergarten people. What are the major risk factors? Overcrowding, close community association, school and kindergarten, college dorms. In fact, that is why here in the US, before before you are admitted to college, they make sure you have been vaccinated against vaccine, because college dorm is one of the risk factors. And of course, malnourishment, especially in developing countries. Malnourishment, where the nutrition is poor, where there's poor nutrition. These are all the risk factors that may give rise. What do you see? How does the virus travel through your body? Very interesting. You can see, and in fact, on the right, I give all the timeline there. I give all the timeline. With your fever, the virus enter and infect the reticuloendothelial organs, endothelial cells, your liver, your lung, your heart, all the internal organs. The virus enter and infect all those, what we refer to as the reticuloendothelial organ, from where it spread to the skin, where the maculopapular is developed. Let's also know this. In my previous slide, I told us about the difference between the maculopapular we see in chickenpox and that of measles. The rash is a rash in measles as a result of the attack of T cells. It's not directly the effect of the virus. And so therefore, what do we see here? The macular papule we see in measles does not contain the virus. The virus is not inside. The virus is not inside. It's not inside those macula. That's a very big difference between it and chickenpox. Please let us know this. But the virus is very present in the blood and in the respiratory tract. Also in the nasopharyngeal, tracheobronchial, and the conjunctival lesions. Copley spores, that is another thing. It's only in measles. No other disease. It's only in measles we have Copley spores. It's only in measles, and therefore it is pathognomonic. It is used for identifying the virus, to rule out every other asymptomatic disease. I've just showed up from what I just explained. On the right is the timeline for each of those manifestations, of those clinical symptoms. What the incubation period is between 6 to 18 days. I told us that one earlier. 6 to 18 days. Prodromal phase is characterized. There are three stages of the virus. Number one, prodromal phase, which is characterized by fever, the 3 C's, which I talked to us earlier. And of course, you see at the base of the tongue of this baby, you can see those whitish exudate. That's exactly the Copley spores. It's only in measles we have this. We don't have it in any other viral disease. Copley spores. Once you see that, probably nurses, doctors, probably when you are suspecting a child with measles, even before the appearance of rash, you ask the baby to open the mouth and see the base, and you see the base of the tongue. If there's a white exudate, like we are seeing in this picture, you have every cause to suspect measles. That is Copley spore. It's acute, highly contagious. Maculopapular rash, fever, and respiratory tract symptoms, they follow after this. What's the next thing we see? There's the eruption stage. This is really very important. You can see on the picture the whole body now covered by the maculopapular rash. Remember, I told us inside those maculopapular rash, there's no fluid there. The virus is not there. The time. What is the time? 3 to 5 days after fever. That's when the eruption phase starts. 3 to 5 days after fever. What do we see? We see the maculopapular rash. The sequence, it follows the sequence, unlike what I told us in chickenpox, where the whole appearance of the maculopapular rash appears simultaneously. But what do we see in measles? Measles rash begins behind the ear, along the hairline from where it spreads to the face, neck, chest, back, abdomen, to the limb, to the hand, and even to the feet, to the palm of the sole. Temperature rises continuously here. Temperature continue to rise, and may even get to almost 104. Almost 104 at the peak of the disease. At this time, the disease can even develop into toxic symptoms. And what the last but not the last stage, you see the presence of measles. Measles antibody after recovery. That child is protected. One good thing about it, don't forget I tell us that measles is a single serotype virus. Once a child recovers, that child can never be infected again by measles because the body has developed a secondary immune response. That child can never be that child can never be infected again. Although there may be complications later on as adults, which is what we are going to see. We shall see those complications. Respiratory tract become more susceptible. Yes, I need to say this, because measles is one of those viral diseases where there's immunosuppression, but not at the stage of what we see with HIV anyway. There's immunosuppression. Immune system is suppressed. Immune system is suppressed. So therefore, what do we see? This gives room to complications. Respiratory tract becomes more susceptible to invasion by bacteria. Bacterial secondary infection. We see bronchitis, pneumonia, middle ear infection. The worst of the complication is what we call the one we know as bronchopneumonia. Bronchopneumonia. It can even be worse. The baby can even develop myocarditis, inflammation of the heart muscle, and laryngitis, and of course, bilateral cataract. Incidentally, I've seen a child with bilateral cataract complication. That child, the eye just looking like the eye of a cat. It can be as serious. So let's make sure we get our vaccine. Let's make sure we protect our children against. Except for neurologic complication. This is another group of complications we see in measles. Encephalitis may be accompanied by deafness and mental retardation. That child will not grow. A 14-year-old child may be looking like a 5-year-old child. There's mental retardation. So acute sclerosis panencephalitis. This is the most serious. This is the most serious of all the measles complications. And it is SSP is only on adults who had measles while they were babies. Again, something similar to what I told us earlier in my previous slide on shingles, on chickenpox and shingles. But here, this case is called subacute sclerosing panencephalitis. It's a disease of the central nervous system, and it's really very, very difficult, very, very serious in adults who had the measles as a baby. It occurs several years after measles infection. Occurs several years after infection. And it is caused by a variant. In fact, that was how it was linked to measles. It's caused by a variant of a deficient measles virus. A deficient measles virus. That is the cause of the SSPE. Very serious. So what do we see? How do we diagnose? Good. I'm almost coming to the end. How do we diagnose? I mean, the clinical diagnosis is a bit simple. You are looking for Copley spot. You are looking for the rashes. You are looking for the Copley spot. But how do we diagnose? How do we know differential diagnosis? The virus grows very, very well in cell culture. In cell culture, giving rise to what we call cytopathic changes. Because of the fusion, you remember when I was telling us about the structure of the virus, I told us of the F protein, which is at the surface of the virus. The virus uses the F protein to fuse both infected and non-infected cells together, forming what we call syncytia. There is cell-to-cell fusion, which occurs in form of syncytia, in form of syncytia formation. And this is facilitated, as I just told us, is facilitated by a combination of the H and the F protein, the hemagglutinin and the fusion protein. Fusion of infected cells with uninfected cells, which may produce what we know as the multinucleated giant cell. Again, you can't miss it. You can't miss it with measles. This is what the picture we are seeing here, both on the left, the stayed and the unstayed. You see the arrow is pointing to the syncytia, multiplication, fusion of both infected and the non-infected cell, giving rise to multinucleated giant cell. And it's more pronounced. It's more pronounced in that picture that is stained. You can see all the cells coming together. What is the epidemiology? Worldwide spread. What is the worldwide spread of measles? Measles is endemic throughout the whole world. It's endemic throughout the whole world. Epidemic recorded regularly every 2 to 3 years due to that accumulation. Due to the accumulation which I told us earlier. It's very, very contagious. Even the vaccine coverage is about 90, 95, but those five that are not infected, that are not immunized during the mass immunization, will eventually form a susceptible population. A susceptible population, which, if the measles virus is introduced, may become a serious outbreak. Introduction of the virus into susceptible population will always result in an explosive outbreak. It always results in an explosive outbreak of the virus, of the disease. That is why it is advisable, even in countries where the indigenous virus, like the US, even in countries where the indigenous virus has been eradicated, it is always advised. It is always advised to continue to get the vaccine. Don't say because you have the virus. Don't say because the virus is no more in your country, you are not going to take the vaccine. That will be very, very dangerous. Not in this age when people travel a lot. People travel a lot. In Europe to America here, it does not take more than 6 hours. Somebody is there. If somebody is not vaccinated, to find himself in California, in California, for example, where people are not vaccinated, it can lead to explosive outbreak. So therefore, mass immunization has reduced prevention and control. Mass immunization has reduced the number of cases worldwide. It is advisable to continue, I've just said this, it is advisable to continue vaccinating, even in countries where indigenous strains have been eradicated, where it's no more circulating because of the accumulation of the susceptible. I told us at the beginning, between 300,000 to 500,000 susceptible people will keep the virus in circulation. We keep the virus, we keep the whole of that country susceptible to the disease. And we know, once it starts, we know what happened. I think that was around 2014, that the last outbreak that started in California. Before you know it, it has spread to so many states in the US. So it is advisable to always take the vaccine. Yeah. Thank you very much. I think we have come to the end of the slide, come to the end of my presentation for today. Once again, I advise, please subscribe. I hope you are going home with something. Students, my colleague, please share this slide. Share my slide, like it. I want to hear about your comment. Subscribe. And if you have subscribed, please tell your friends to subscribe. Good information is being dished out here. So I hope to see you again. Good friends, students, I hope to see you again in my next slide. Till then, have a wonderful day.